Going to move on to the next final speaker of the session, Dr. Jing Han. Jing Han is a research associate at the Department of Computer Science and Technology in the University of Cambridge. She received her doctoral degree in computer science from the University of Augsburg in Germany in 2020. Her research interests are related to deep learning for human-centric multimodal healthcare and effective computing. She's an IEEE senior member and serves as an associate editor of the IEEE Transactions of Effective Computing. And today she will give us a talk entitled Your Voice Matter, What Can Sound Tell about Your Health? Thank you.
Thank you. Thanks for the introduction, and thanks everyone for coming to today's workshop. Still here for my talk. So my talk is about the correlation between our voice and the health, which is not really very commonly here or used as a material to be used as testing tool in hospitals. So this is the outline. I will first walk through some key concepts of human voice, understanding it, and then the current stage of voice-based health analysis. And then the main focus is in the past few years about our project voice-based COVID detection, and then comes to the end about the challenge and opportunities of voice for remote health. So first, about the human voice. We know this voice production is a very complex procedure where our brain and many other organs and muscles are involved. And for example, and currently whether you can hear a sense whether I'm nervous or relaxed, and I'm not a native English speaker, and in your brain, I believe that automatically already convert my speech into a text. So these are quite common things people might think about when we mention about human voice. However, today we are going to talk about whether we can explore the voice for health related issues. So first, it's not a new idea that we can identify some illnesses from the sound. For example, when you go to see a doctor, there are some cases that the doctor will use a stethoscope attached to your chest to listen to the long sound when you breathe in and out, and to identify some abnormal lung sounds like wheezing and crackles, to identify some abnormal respiratory sounds.
I think that's not working. Sorry.
And also, there are the health providers will provide such kind of voice therapies where they try to help to improve your articulation when you when you pronounce some words or sentence. And besides of the physical health, there are also voice can be used for mental health analysis. Like when during an interview, the doctors can ask you to answer several questions or questionnaires where they will try to identify your mental health status, especially in the voice. They can analyze the speed, the tone, and the words they use when you answer these questions. And accordingly, there are talking therapies where try to help to improve the mental health, and the voice is a vital part to be analyzed. And today, the next few slides will mainly talk about our previous project about audio-based COVID detection, and commonly used testing tool in as listed here, like the lateral flow test, PCR, and the CT scan are quite common. However, they are somehow needs to be done by expert or analyzed by expert.
And as researcher in audio signal processing, we are interested to know whether we could explore some audio-based application which can identify some signatures from the voice, like from coughing, breathing, or the speech when you talk. So after we collecting some audio samples, we send it to doctors who are working in frontline in the COVID ward for the past 2 to 3 years, and who is sensitive to these COVID sounds. And he notified some patterns in these abnormal sounds, and without earlier knowing that these recordings are positive, but identified, noted, they mark it as positive and correlate their estimation with some hints from the voice. So in this figure on the left side are the waveforms from one sample of one positive participant, and the right side are the spectrograms, which is kind of a representation in time and frequency domain. So for example, in this sample, the doctor noticed down that there are some spontaneous cough when we ask the participant to just provide the breathing recording, or there are wheezing cough during their cough session, or there are sniffing also spontaneously after they developed the sentence recording session. Or in another example, from a different participant who was also positive detected. In this recording, there are different patterns such as long expiration when they breathe out, or the wet cough during the induced cough session, or their voice sound tired and nasal. So we see that from different COVID positive patients, there are different patterns, but still they are possibility that we want to see if when we collect a large scale of data, and whether an AI model can capture these patterns and tell automatically whether this person is infected or not. So with this aim, our group developed an app which can collect these audio songs when you download the application on your mobile phone, and provide not only these songs but together with the symptoms and some demographic information, as well as some their medical history, and of course their COVID test result. So far, we have collected more than 500 hours data from worldwide, and there are over 36,000 participants. And these data are quite rich and also available for research purpose. So besides of COVID detection, this data has already also been used for asthma detection, because in the data we ask the volunteer to mark down whether they have other health issues. And also I think like Lauren can use this for engagement study, because we ask the volunteer to come back every second day to provide further recordings, and there are even some volunteers who are very loyal, provide us over 1 year data. Yeah. And then after collecting this data, we try to build an AI model, the detail of which I will not go through here, but the aim is to analyze the provided audio, purely audio sample, and the outcome will be whether the model thinks the recording is more COVID-like or non-COVID. So instead of using all the data we collected, this data should be first cleaned. So with a smaller curated data set, we achieved a performance in terms of sensitivity and specificity like this. Although it's not perfect, but it tells something like there are signals in the audio which can kind of distinguish between COVID positive or negative, or at least let's say from symptomatic versus non-symptomatic one. Besides that part, as earlier mentioned, we collect the data continuously, like the users are asked to provide more than just one data sample on one single day. So we are interested to know whether there are the AI model, audio-based AI model can track the trajectory of the disease. So instead of using just one recording, the input can be a sequential data of the recordings of several days along the time, and the output can also be a sequence along the time. So the aim is that we could see whether use audio, explore the audio and see the disease trajectory, or say the from the onset to a recovery stage. And here just to list two examples where the first one is a patient who reported positive, and the model predicted the probability of positive about 0.5, and then along the time, the probability of positive decreased to below 0.5, means negative estimation, or for another participant, the probability kept below 0.5, means this participant always stay negative. But unfortunately, in this data set, we do not really have many people who are first negative and then develop positive. Mentioning earlier that together with this data, we also ask the users to provide the symptom information. So in another study, we also try to combine the audio with other modality. In this case, it's the symptom, and see whether what is the outcome. So basically, we observed that performance increased together with the symptoms as additional input. And earlier, Abby also mentioned because such kind of signals are quite sensitive, so there are efforts. We try to study the federation scenario, which means that you do not need to upload the data to the center device, but use it locally, and still we can achieve comparable results as a global model. So having that comes to the end of the COVID project, and here just generally say about some voice for remote health challenges and opportunities. So here are some opportunities. As mentioned earlier, voice is produced by our human body, so there are other disease or illnesses that can indicate by the voice changes, and here I just list some of them. And also, why we think it's good if we can involve the voice for health, especially remote health, is that the data, the audio can be collected and analyzed remotely, monitoring around the clock, and it's almost costs nothing, and it's not invasive, and perhaps the microphone is available in almost every smart devices. And Last but not least, I think also already mentioned earlier by Cecilia and Richard, the digital health or remote health has many challenges, and here I will not go through them one by one. So to sum up, I think there's still a long way to go for voice for remote health, and that's the good time that researchers from multiple disciplines can work together. And thanks for all members for this COVID Sound project, and I'm happy to answer any questions now or later. Thank you.
Thank you. Do we have any quick question we can do before we all head for the reception? If not, I can encourage everyone to go outside and do some networking and bring your questions for Lauren and for Jing. Thank you, everyone, and thank you all the speakers.
Thank you for being here.
Yes.
Enjoy the reception.